Hi everyone. We are going to be talking about normal appearance of cartilage today, and this is not with any fancy sequencing or post-processing. This is on our standard reporting. So we're going to look at the different layers of cartilage, or the appearance of them, and then we're also going to look at why we get that, so have some understanding of that, and some of the variations that you can see in normal cartilage. Okay, so let's start. We're talking about the normal appearance of cartilage today, and this will depend to an extent on what sequence you're using. We will be talking about proton density sequences, but the general rules that we're going to talk about will apply to other sequences as well. And how well you see these changes also depends on the thickness of the cartilage. And we'll be using the patellofemoral joint, so it's a bit more visible and obvious. Normal cartilage has a trilaminar appearance, and what we mean by that is that there's different signal. So the deeper layers of cartilage, here the blue arrow, is quite dark. We have an intermediate layer that's relatively bright, and then there's a superficial layer where the orange arrow is, which is dark again. So we go from dark to an intermediate signal to dark. So this is what's called the trilaminar appearance of normal cartilage. The thickness of these layers is variable. If we look at the trochlear cartilage, the deeper layer here, which is dark, is relatively thinner than on the other facets. So it's not a uniform thickness. Additionally, the signal can be variable. So if we look at the superficial layer here, it's quite black, but if we look at the other facet, it's not so black. Okay, so again, this is a normal appearance. And if we look at the trochlear apex, here we really don't have much of a dark, deep layer at all. The other thing is also that depending on their scan plane, this signal can vary. So this same patient, we have a sagittal scan where we've got a relatively dark, deep layer, but at that same level on the axial image, the deep layer is not so dark. The other thing that's normal is this striated appearance at the deep layer. So here we've got relatively uniform dark signal, but as you keep coming towards the apex here, we've got areas of low signal interspersed with high signal, and that is again a normal appearance. That striated appearance in the deep layer is normal. So why do you get this signal change? And it's all to do with the orientation of the cartilage fibers. So this image has been adapted from this article. The link will be in the notes. And this is the deeper layer of cartilage, and the deeper layer of cartilage is relatively vertical. The superficial layer of cartilage is relatively horizontal, and in between, this intermediate layer is where the cartilage fibers arc over, so they've got a more of an angle to them. And there are various theories regarding this. Some of the theories relate to T2 decay, saying that in the deeper layers there's faster T2 decay, so the signal drops. The signal in the intermediate layer has a longer T2 decay, so then the signal is higher, and then as you get to the superficial layer, the T2 decay is strong again. Some theories also talk about magic angle, saying that this orientation of the cartilage fibers results in a magic angle effect, which is why that intermediate layer is bright. I think for us, in terms of diagnosis, it doesn't make too much difference, but it's useful to have some understanding of why there's a difference in signal. So in summary, what we're saying is that the normal cartilage will have a trilaminar appearance. The deeper layer will be dark, the superficial layer is dark, and we have an intermediate layer which is intermediate in signal. We've also said that the extent of this signal is variable, so it doesn't need to be uniformly black, uniformly same size all the way through. And we can also have variations in whether we see the signal or not. So here we've got very low signal, not so low here. And these are all normal appearances.